Bore da pawb a croeso cynnes i'r gweithdy hyfforddi a datblyg. Good morning everybody and a very warm welcome to our training and development workshop. Our workshop will be delivered via the medium of English as we've had no requests for contributions in Welsh. My name's Claire Sterry, I'm Senior Officer Third Sector Development with Pavo, and I'm currently responsible for Powys Volunteer Centre, and I also manage all the Pavo administered grant schemes. But I've been heavily involved in training, delivery and development for probably the past 10 years. So really pleased to see you all here this morning, and I'm going to pass over to Melissa so she can introduce herself now.
Bore da pawb. I'm a development officer with Pavo. I support with a focus on digital, but support organisations with any inquiries they have, whether that's governance, funding, policies, whatever they need, we support them with. And I support the training programme for Pavo and making sure that we have training courses within our website for members and non-members to access to gain additional knowledge around a particular subject.
Diolch, Melissa, lovely. So we're really pleased that you've joined us for this session this morning. So the workshop's going to provide an opportunity to hear about the new Health and Care Academy, with an opportunity to ask questions with Louise Richards from Powys Teaching Health Board. We're going to provide a taster training session to give you an overview of a regular training topic and our current training offer. And we're also going to provide an opportunity for you to tell us how you think Pavo training should be delivered to the sector, as your involvement and feedback is really important. So a very diverse session, which we hope you'll find really useful and interesting. Please introduce yourselves in the chat pane, and if you've got any questions, please do put them in there during the session. So let's crack on then. So our first session, we're delighted to be joined by Louise Richards, who is Joint Health and Care Strategic Workforce Planning Manager with Powys Teaching Health Board. And she's come to talk to us about the really exciting development of the Powys Health and Care Academy. So I'll hand over to Louise now.
That's lovely. Thank you, Claire. Thank you, Melissa. And it's really a privilege to be here today to talk to you about a pioneering piece of work that will really help and support our carers and our volunteers and staff within the health and social care sector, actually, in Powys in the coming years. So thank you for inviting me. So just to come here today to talk to you about the new pioneering Powys Health and Care Academy. We all know, for us that live locally, you know, we don't have a university on our footprint, and so we lose a lot of our younger population. They leave county to access academic education. They go outside of county to do that. So what we really wanted to do in Powys was make sure that we had a facility that enabled our younger population and older populations as well to learn, study and develop their skills closer to home and in county in Powys. So just moving on to the next slide, the purpose of the Health and Care Academy really is what it says on the tin, is to provide education, training and development for all of our workforce. So that doesn't just mean our paid workforce, but actually our volunteers and our carers, to make sure that they've got the tools available to them through skills and education so that they can support the health and care delivery in Powys. So the Academy is aimed to enhance that locally for us. And the idea that it'll be a hub and spoke model, what that means is we'll have a series of physical spaces, state-of-the-art spaces that will come online over the next 5 years, that will be able to offer practical, academic and digital learning opportunities through 4 schools. So moving on to the next slide, you can see there the ambition of the Academy is about providing rural, professional and clinical education through integrated training. The focus is on direct care, shared care and care delivered through a digital lens, to ensure that we become a sector of choice in Powys and a sector of choice, a region as a sector in Wales as well, by delivering training through education and learning. We also, as part of the academy, there's an element of leadership, and one of the schools is around leadership development, and I'll talk a little bit about that now shortly, but it's about making sure that we've got leadership working at all levels across all of the system, with again a focus on digital transformation. And hopefully then that will enable us to respond to people's needs in a timely way, and by ensuring our workforce, including our volunteers and carers, have easy access to skills development and education opportunities. And then the last point then around the academy is the research, development and innovation lens, which underpins all of the schools. So what we will be delivering is making sure that education is sort of evidence-based, and we've got a piece around research that enables us to explore latest ways of working, whether that's through technology, industry relationships, and then hopefully supporting our core economy. So just moving on, we've got the 4 schools. So within the 4 schools, brilliant, thanks Melissa. So within the 4 schools, the 4 schools consist of, I'll start at the bottom, the School of Volunteers and Carers. The second one is the School of Leadership. The third one is the School of Research, Development and Innovation. And as I said, sort of is a golden thread through each of the other schools. And then the top one then is around the professional and clinical education and training. So just focusing on the School of Volunteers and Carers for the moment, this is about ensuring that they remain a core and important part of the broader workforce, and is making sure that they're equipped and they've got the tools to be able to deliver the support that's required. So through this school, we'll be developing a skills matrix that will help us understand what skills are required, what skills we've got available to us, and how those skills can be used in a different way. It will also include then a portfolio of training. So we'll be working with colleagues across the sector to look at what our gaps are. So we know that there's a great deal of education opportunities currently available, but we potentially don't know what the biggest gaps are. So we need to understand that so that we can make sure that through the academy, we deliver the right skills, education and training. Melissa, can we just move on to the next slide there? So these are some lovely visuals. These are the actual designs of our hub space that is already, it's just coming, we're just waiting for some technical kit to be put into the building. But here you can see some of the innovative spaces we will start to see now through the academy lens. So this is the first building. So it's actually a refurbishment of a protected building on the Bronclease campus. And this will form part of our hub space. If I can just move on to the next slide, Melissa, and you'll see then actually the sort of design, 3D design pictures coming alive really in these real pictures. So you can start to see the building as it currently stands. On the next slide, we've got the second phase on the Bronclease site, which is really, again, really exciting. Something that we haven't seen available anywhere in the UK to date. So we are in Powys are pioneering this piece. And this is the adapted simulated living space. What we're doing is we're converting one of the bungalows on site, which is just by the hub space. And that adapted simulated living space will enable us to start to deliver training in a home setting. So if you think about some of our health and care training we currently deliver, it's always done in a sort of clinical setting. So the exciting piece with this is actually we can start learning in an actual home simulated environment. It also will enable us to start to look at and share and learn about technology that keeps people at home safely. So again, something that hasn't been sort of tested before across the UK. So we're really excited that we're going to be able to do that. And it really, this particular phase of the work really helps us target the way that we deliver services in Powys. So we're community based and a lot of care is provided from the home. So as I said, I can't say enough how excited we are about the second phase of this work. Just moving on to the next slide now, and you'll start to see then the third phase. So we're talking about the Broncleys Hub being a campus where we will have the Baselwed building, which is the first couple of pictures that you've seen, and that illustrates the hub building. We've got the adapted living space, and we are also going to capitalise on some of the beautiful outdoor space that we've got on that campus to have some outdoor learning facilities. So on this slide, you'll start to see some of those outdoor learning spaces. Both the adapted living space and the outdoor space will be ready now by the end of March. So we are really coming quite close to a sort of official launch of this site. It doesn't stop there then. I talked earlier about a hub and spoke model. So just to move on, Melissa, to the next slide. What we've also started doing is obviously because of the geographical footprint of Powys, we cover 25% landmass of Wales. We want to make sure that our physical spaces are accessible to all. So we're already in conversations with colleagues across the sector to start to have other physical sites coming online. So we've already done the specification for the new North Powys Wellbeing Campus in Newtown, and that specification is based on the work that we've done in Broncleys. That's not going to hit us for 5 years. So in between that, we've got some other physical spaces that are being developed where we are trying to build in the academy facility into those spaces. So again, people can access that innovative simulated environment across the whole of Powys. So really, really exciting there. Melissa, if I can have the next slide. So what I would say is the Health and Care Academy is not just about the physical spaces. The physical spaces are really important. And what we've tried to do with the physical spaces is make sure that they're future-proofed from a digital lens, so that enables them to speak to each other. So if you just imagine, you may have somebody sitting in the Broncleys campus, but actually somebody sitting in the Newtown campus, and they can both experience the same learning. So it's been a real key focus that we connect the different sites up together. It isn't just about the physical sites though. What we've tried to do with the Academy is kickstart some important pieces of work that really start to ensure that we are encouraging health and care to be a sector of choice. So what we've focused on is the sort of widening access to employment for the sector. So again, through the lens of training, we've taken part in a variety of widening access opportunities. Kickstart being one, which targets 16 to 24-year-olds that are universal credit claimants, where we provide 6-month work experience through the academy for them, with the ambition that we would help them into employment. The other project that we've been working on is the Arwen project, which focuses on employability skills training. So where we would support paid staff, support volunteers, support carers to access things like, applying for a job, presentation skills, interview skills, and coaching and mentoring. Again, just to help them along the pathway to help them seek employment. So again, it's sort of helping people into that sort of workforce. We're also working on a schools project. So we'll start to deliver health and social care training to year 10 and year 12 students. And that will be a vocational piece of work. And again, to encourage people to come into the sector. So I have to say the last 2 years has been about laying the foundations of the Academy, and we're really pleased with the work that we've done so far. But this is just the start of our journey. And I think having the adapted simulated space is really going to take us to a different level. One of the other things I've touched on earlier now is around that leadership offer. So we will, through the Powys Health and Care Academy, be delivering one of Welsh Government's intensive learning academy, which again is another academy word that really confuses things. But this will focus on digital transformational leadership and will be offered out across the sector, including to third sector colleagues as well. And again, we're talking about leadership at all levels. The work has been delivered in partnership, and I have to say, when we developed the Health and Care Academy blueprint, which I'm happy to share with colleagues after today, that was co-created with colleagues from across the sector. So we worked with over 300 people to help develop that blueprint. And we will continue to work like that because it's really important that we understand what it's like as a lived experience for a member of staff or a volunteer and carer that is working within the sector, and how we can best support them through the academy lens. What we do know is we still have a lot of work to do to understand what the lived experience is for colleagues working in the sector. So as we move now into the next financial year, we will be focusing on engagement and well-being to ensure that we are providing an enhanced service for those that are caring within the communities. The project, just to give you an indication of the value of the project, is actually attracted over £1 million worth of investment through capital and revenue projects. So we are really, I think we feel really privileged that actually people are taking notice of education, training and development in Powys on a local leadership basis, but also on a national basis as well. So we know that this work is going to maintain that sort of commitment, and would really look forward to working with you all to develop the academy as we move forward. So I'm going to stop there now, but would welcome any questions or queries around the academy and how we can potentially work together now moving forward.
Okay, so has anybody got any questions for Louise? It's such an exciting development. John?
Yeah, I'd just be interested to know what the connectivity is like at Brontleith. Is it fibre enabled?
No, actually, yeah, it's fibre connected. So we've got the infrastructure there. The facility enables people to come in and use their own piece of equipment by linking to the Wi-Fi, or you can hardwire in. So we've got connectivity points that enable you to hardwire in as well. They'll also, John, be if individuals haven't got IT equipment, there will be a bank of surface hubs that people can come and use. So if for the purpose of research or connectivity, people can come in and sort of loan those items on site as well.
Yeah, one of the reasons I asked is that the actual rest of Brontleith, particularly the acute ward, doesn't have fibre, and it's dreadful there. I help on Patients Council there, and the connectivity is dreadful. If only they could enable the rest of the ward, it would be brilliant. Because running Zoom calls with Patients Council, we sometimes have dreadful problems with it. So if it could be expanded to the rest, even the staff have problems with the internet at the moment. And if that's got fibre, why isn't the rest of the hospital? Well, it's all, yeah. Okay, thank you.
Interestingly enough, John, how does that patient group work?
Again, it's funded by Pavo, and I'm a former patient, so there's me and a couple of other colleagues, and we go. We used to visit in person sort of once a month, but obviously post-COVID now we're doing it fortnightly via Zoom, and we meet the patients and chat about any problems they have there, and represent them to the management and take action there.
Brilliant. Okay, I'd be keen to catch up with you, John, and hear a little bit more about that project after today.
Yeah.
Lovely, thank you, John. Question in the chat from Ruth at Knighton Community Centre. There's currently no qualifications pathway for volunteers. Will the project start addressing this issue?
Absolutely, and really good question, Ruth. We really want to widen the access at both ends. So when I say both ends, we want to help volunteers get the qualifications to come into a paid role, but also we would like to help paid staff move into volunteering roles when they find that they have come to the end of their paid career and they've had enough of that, but actually they would still want to contribute. So we are really focusing on those sort of career pathways in and out of the sector and across the sector as well. So that would be absolutely a piece of work that we would be looking at.
Lovely, thank you, Louise. Question from Anne, Bracken Trust. How will individuals or organisations access these facilities?
So Anne, we're in the process of scoping a digital platform which will be available to all. And on that digital platform then it'll be a little bit like, the best way to describe it is our shop window that describes what's on offer. What I'd like to see within that, that digital platform is a portfolio of skills development and education opportunities. I'd also like to see some wellbeing initiatives on there. And what we will do as well is link in a wellbeing app to that people can access. And the other thing is around forums. So the platform will enable us to have those digital forums as well. So we're currently scoping that at the moment. And the plan is that will be ready early next year. So I would say before the end of March, that will be sort of active and ready.
Lovely, brilliant. Great questions from everybody. Louise, how can people get involved in developing the work plan going forward?
So would really welcome people to be involved. We work closely with Pavo, and so if anybody wants to be involved in the stakeholder mapping exercise and be a stakeholder and be involved in the development, then please get in touch via Pavo and we can ensure that you are part of those discussions as we move forward, because it's really important that we understand what's happening, where the gaps are. We don't know that ourselves, so it's really important that you guys engage with us and help us with that.
I've just put my email into the chat bar. If anybody wants to get involved with that, just drop me an email and we'll get that sorted. That would be brilliant. Any other questions from anybody at all?
Phil's got his hand up.
Oh, Phil.
Oh yeah, with it being such an exciting project, and you mentioned there was 300 people involved in the planning of the model, I just wondered how you sort of facilitated making sure that everyone sort of had their points set across, because in the sort of AGM, everyone's been very keen to sort of get involved and sort of point things in the right direction. I just wondered how you sort of managed to facilitate that.
So, because the work is commissioned through the Regional Partnership Board, Phil, we've got citizen membership that sits on each of the partnership groups. So we targeted those groups because they were people that were already sort of working closely with some of the sovereign bodies and actually third sector providers. So we worked with them initially. But again, as I mentioned, what we've tried to do, we've really embedded that partnership approach. And through Pavo, we're a key partner in the work. So, you know, through the Social Value Forum, we've got connections through those links as well. And again, what we will start to do now is we start to move into the next phase of work. You know, if you think about it, up until now, it's been about laying the foundations of the academy. What we've got to really nail now is what the offer is going to look like. You know, so we've dabbled in a couple of widening access pieces. You know, we're working through what the School of Volunteer and Carers looks like. But actually, there'll be another large engagement exercise where we'll be, you know, checking and challenging some of the data and some of the actions that potentially we would want to put in the delivery plan for the next 3 years. So if you can, you know, welcome you to get in touch with me or Claire, and we can start to pull you into that piece of work if you want to be involved in the next phase of the development.
Thank you.
Lovely, thank you. Any other questions?
Yeah, I've got one. Sorry,
Gareth?
Yeah, thank you. Brilliant looking at this and really exciting, and obviously opportunities. How are you going to look to bring in the wider community? Because for me, you know, what you're offering, especially around the Brontlis area where I live, I think is really exciting. So obviously just sidestepping a little bit sideways, and how do we bring wider community groups and community into this so they know what Brontlis is offering, and obviously the Health Board are offering, and we're offering really.
Yeah, so just so that I'm clear, just that I'm clear with regard, the Academy is a sector initiative, so it isn't though. The Health Board have invested a lot of investment with regards to donating a building and are a key partner in the work. There are also the other two key partners, Social Care and Pavo, who represent the third sector. What I think I would like to see is more citizen representation. So we've got a governance structure that operates through a programme board. And I think it would be really great to start to see some community representatives at that level to engage with the work. And I'm happy to pick that up outside of this conversation to take that forward.
Thank you very much. Yeah, that's very, very good to hear. Thank you.
John?
Yeah, would there be plans for like a peer support group of representatives and service users and carers? That I think that would be a good idea as a
John, I think that would be brilliant, because I think if you think about it, we've been laying the foundations up until this point now. We're probably not going to see the impact of the academy potentially for another 12 months. So we can start to understand the impact on the staff, and the workforce. But what we want to really do is understand what that has done, what differences that made to service users. So I think as we move forward, as part of the stakeholder map, so who we need to engage with, I think absolutely a peer group would be a priority for moving forward.
Yeah, at the moment we've got a new initiative in Engage to Change, where myself and some of the representatives are going to get coaching at Brontlis from trainee psychiatrists, which I think is a brilliant idea. So
amazing.
Yeah, if you develop something along those lines, it would be brilliant.
And I think if you think about it from the adapted living space, what it would be really amazing is if we had community representatives coming in and working with staff to learn about how we skill people up. So acting really in a volunteering capacity to help skill and train the workforce. you know, I think that would also be great as well. So yeah, absolutely, we definitely would be looking at that as well.
Fabulous. Any more questions? I know Louise has got to leave for another meeting, but some really interesting questions. The space, I've been very fortunate. I've seen the space. It is so inspiring, just fabulous, and just the potential for the academy is phenomenal for Powys. It really is groundbreaking. So it'd be great if you're able to get involved with that development, then we would very much welcome that. Diolch, Louise. Thank you so much for your time this morning. That was a fantastic presentation.
Thank you.
We'll see you soon. Take care.
Bye. Bye.
Lovely. So we're going to change tack now. I'm going to hand over to Melissa, who's going to lead the next session.
Thanks, Claire. So we're going to have a session now around Pavo training. So I'm just going to introduce you a little bit to what Pavo training is about. And then within that, we'll have a quick taster session of one aspect of one of our funding courses. So Pavo training, what is Pavo training initially? So Pavo training offers a wide range of courses to third sector organisations across Powys. And we offer these courses at a discounted rate anyway, so that they're affordable for the third sector. And then we have a further discount for Pavo members. And if you aren't Pavo members, it is free to join. So you're missing out on that training opportunity of having training just slightly cheaper by being a Pavo member as well. By being a Pavo member, you'll also receive updates from Pavo around funding, news, and other things that's important to the sector. So in terms of our training programme, we schedule courses each quarter, and that depends on the need that we're seeing through inquiries that we've received, through training requests, and then that quarter of training is put onto our website for individuals and organisations to book onto the sessions, which at the moment are all delivered online. For those that want more detailed training, we also deliver tailored sessions to organisations, which are our bespoke training courses. We do have an additional charge for those, but within those they are tailored exactly to what the organisation requires, and the organisation is able to then feed in and actually develop that training before it's delivered to the organisation. So Pavo training tends to consist of an aim of the session and the course outcomes. These are always on our website beforehand, so you can see what the full outline of the training is, and have a look at those outcomes and the audience for that particular training as well, so you can see if it meets your need beforehand. You can also email us at training@pavo.org.uk, or telephone us if you just want to check whether the training is suitable for you. Our training courses have exercise and activities throughout them, as well as opportunities for discussions. There's always opportunities to ask questions, and that's depending on the trainer, will either be throughout the course or at the end of the session. And a really important part of our training is that learning from others and hearing from other people's experience as well, so that you don't just get the training that we've delivered, you actually hear from others and how they've developed things and what they're looking for as well. Our most popular course, you'll be surprised to hear, is funding training. So funding training is the one that we receive the most requests for, and what we're going to do now is to have just a quick taster session around one of the aspects of this training course. I'll give you some information beforehand, and then we'll have a discussion. We'll all stay together and just look at a particular scenario to then take that forward. Before we go into that, just in terms of our funding training, due to online delivery, we actually changed how we ran our funding training. Initially it was a 4-day course, and we did have a 2-day course as well. but because obviously online it's a lot to take in, what we've done is split it into 2 online sessions that are around 2 hours. The first session is around that theory, particularly looking at planning a funding proposal and going through that whole process of a funding bid. And then the second day takes all that learning and actually puts it into practice. So you then have a hands-on experience of actually writing a funding bid. You are as well put in to the eyes of a funder and get the opportunity to assess a funding bid yourself. So you can see within that where potentially, in terms of your funding, you would like to change how you currently write funding bids, or actually to emphasise the things that you're doing well from seeing that particular funding bid and assessing that. So I've taken out the planning cycle, which is one of the main areas we cover within the funding training. So the planning cycle is all about taking you that step away, and instead of looking at the funding and the money that's needed to provide that, actually coming back to what that issue is, and from that issue how you actually intend to resolve it, and then from that actually taking that forward to create a funding bid. Funding applications are more likely to be successful if they are carefully planned, and this planning cycle is a really useful tool to make sure that you've got all of those steps in place. So this is the 6 key stages for a planning funding proposal. So first of all, in terms of funding, ask yourselves how you currently plan those funding proposals. Do you use this kind of cycle? It might not be that you have a template like this in place. It may be that just the way you work, you are actually going through these processes, but just when looking at funding, just have a think and see, actually, are you meeting these 6 steps? So step 1 is around the issue. So that's the nature of the issue that you want to address. What needs to change, and what issues need to be addressed. So what are you looking to solve? So that's the first part, having a clear idea of what you actually want that particular funding bid to resolve. Moving on to 2, around aim. So this is the changes you want to achieve for beneficiaries and service users. It may be that you agree a goal or a series of goals to be achieved as a result of the work, but it's your overall aim that feeds into that issue. So what do you want your overall aim to be to solve that issue? 3 looks at the objective. So this is the activities that are going to be undertaken, and the services that will be offered to achieve that overall aim. So essentially, what are your activities, your outputs that are going to meet the aim of that project? The need, that's about thoroughly understanding the problem, examining in detail what that is, gathering information and evidence, getting your consultations, talking to people to fully understand that issue, because it may be that a few people have identified a particular issue, then talking to the wider community, actually it's another issue that's more important, that needs to be dealt with in order to solve a particular issue that you have within the community. And it's really particularly with lottery funded projects, that need is really vital to make sure that you have that there before you start looking at writing that funding bid. 5 is around outcomes, so determining the end results of the project, the changes achieved through the activities. Again, you'll have intended outcomes that you set, but the project itself, when you deliver it, may have unintended outcomes, and making sure that those are actually fed through when you do put through monitoring if you receive the funding, so you can see the full value of that particular funding. And last but certainly not least, the budget. So making sure you know how much money is required to deliver the actions and what your overall aim is for the project. So be realistic, but at the same time, don't undersell yourselves. Make sure you do have enough money within that budget to actually achieve the aim that you want from that particular funding bid. So that's very much a whistle-stop tour of the planning cycle, and we're going to just move into an exercise that's just looking at that issues section. So I have a scenario here for you all, and we're going to have 5 minutes to just discuss that. So the issue that we've identified is your organisation runs a wellbeing activity once a fortnight in a rural town. A lot of attendees look forward to the session as they live on their own, and since the local cafe closed, there is less opportunity for social interaction. A wellbeing club participant has suggested your organisation set up a luncheon club. So I'm going to take this off the screen so we can all see each other, and I'll drop the text into the chat as well, just so you can refer back to it. But I'd just like us to have a discussion in terms of this scenario, to what you would see the issues are, and what would need to be addressed in order to take this forward. John.
Hi, we're looking for verbal responses now, I think. Obviously, if the cafe is closed, then you'd be looking for premises that you could use in the town that are available, that would suit your needs, and obviously you need to know numbers of people that you'd be willing to participate in it. Obviously there's health and safety considerations, food hygiene considerations, location, obviously if it's rural, and if there's only one part of the town that it's got to be accessible.
That's brilliant, John. Is there anything else that anyone can see within that particular scenario? So Anne, are you happy to voice what you've put in the chat?
It's just a suggestion that before we sort of embark on finding premises and things, we need to establish the need. So to ask other group members whether this is something they would want, and is it something over and above what's already running, or would they be joined together, just to have a little bit more information on what is the need here.
I'd also look at if they're coming and saying, you know, they want you to set it up, I'd throw it back to them, well, do you want to be involved in setting it up, and try and enable them to start the project, which you could obviously support them in doing that, but it would then empower them to be involved and run it.
Yeah, because that's really important in terms of sustainability of any project, is that you've got people that will run it and are engaged in it, rather than somebody else do it. And yeah, that's a really important aspect.
So Ruth has just put into the chat about having some pilots, having consulted, running some pilot sessions then as well. Gareth?
I think for me, it's sometimes you've got to go backwards before you go forward and understand why the cafe is closed, and get that bit of understanding first of all, because obviously if there's pitfalls, you don't want to set yourself up to fail. So perhaps a little bit of work with the wider community to understand what they're actually looking for, because when you're going for grants later on, you won't be able to move forward if you haven't got the evidence of the need. So sometimes it's looking backwards, say, well, actually, why did that fail? You know, if it was really successful and they really liked and they were bringing people in, what were the pitfalls? So perhaps a little conversation with them as well, and just to build your evidence base for later on down the line, because it's difficult to get it after it's gone, the information.
Brilliant. So that's really important. It's something that we see quite often, is that people have come forward saying they need this in the community, and it's just that step back just to make sure, actually, is that the need, or is there something else, and where is it stemmed from, in order to have that evidence to then actually put forward funding if the need is required. It may be that there might be other services in the area already, and making sure that those are accessed and people are aware of those, because we often find that particularly within rural communities, that getting yourselves out there and people finding out what's going on tends to be that little bit harder than being in a city and seeing everything kind of around you. Does anyone else have anything they'd like to feed into that, John?
Yeah, just there's a consultation process of obviously that needs to go ahead, and having some sort of initial meeting with everybody who's interested in attending, and working out some sort of co-produced way of getting input from people, because obviously the more interested the people are, that it'll generate more commitment to the task that they want, you know, expressing views. Do they just want a luncheon club? Do they want some other activities there? What sort of things do they require, and are they prepared to help out, basically? And if they invest in it, then obviously then it's going to be better for them.
And Rufus said in terms of sustainability, how will the project survive post-grant? So that's really important to make sure that is in there, particularly if it's volunteer run as well, ensuring how that project will actually continue going forward.
Because continuation funding is just so difficult to come by. Funders will always ask you to reinvent the wheel in some aspect. So just to get a funded year on year for a project is very difficult.
So, and that very much was a whistle stop tour, is a big ask to you to have that discussion. But we just wanted you to see kind of the discussions that we do have within Pavo training, and how they kind of lead from those kind of trainer input areas beforehand. So in terms of that scenario, you would have had a lot more information before actually sitting through that. So thank you for participating in that, and your views are all very valued, and really do actually answer that particular discussion. And it is just about taking that step back and reassessing before taking anything forward.
I actually think they're naturals.
Yes, no funding training needed.
Yeah, absolutely. And that is one of the most important, one of the most valued things about Pavo training is learning from other organisations, because when you're doing the day-to-day job every day, sometimes having that time to network with others, to have those discussions, is very hard to come by. So very often we find within a Pavo training course, it's making the links with other organisations, it's having those discussions that you haven't had time to do. That gives added value to the training. It's really useful. So obviously we're constantly looking at how we can develop and improve our training offer with Pavo. So for us, it's really useful to be able to have the discussion with you guys today about how we can do that. Are we going to stay in the one room, Mel? Yeah, that's fine. So prior to the workshop, hopefully you had an opportunity to fill in a training survey that we sent out. If you haven't filled it in, it doesn't matter. We've had responses and whatnot, because we sent it to our training network as well. So hands up who's attended a Pavo training course in the past. I know Anne has. I'm pretty sure you've come on my funding training, Anne. Oh, Gareth's been on a course. Lovely. Brilliant. And keep your hand up if that was a face-to-face course. Lovely. Raise your hand if it was an online course. Yeah, there we are. So, thinking of what aspect of a training course would you value the most? Having been on a Pavo training course, what was the most valuable aspect of that training? Anne?
Yeah, for me, it's not just learning about the actual subject matter, whatever you've gone to learn about, but it is that peer support and talking to others and sharing ideas and learning, really. You often book yourself onto a course and your diary is so full and you're thinking, oh gosh, you know, can I spare the time? But actually I've found it's really beneficial.
Brilliant, lovely. John?
Like Anne said, a lot of it is networking and putting sort of names and faces together. I found that not just the content of the course, and it was convenient for me because it was local as well.
Yeah, okay.
Not having to travel out to the county was good because it's such a big county as well.
Yeah, absolutely.
Yeah, that was great. But yeah, meeting people and finding their experiences, obviously working in the same sectors as well. That really helpful.
Brilliant. So for those of you who haven't attended a Pavo course, is there any particular reason?
For myself, I haven't, but that's, I think, because I'm so new in post, so it's a new sort of clean sheet ahead for me to see what's coming up and what I could be involved in and what could benefit, you know, all of us, I suppose. So for me, it's just because I'm so new to the area and the job.
Okay. Anybody else?
For me, I'm not part of an organisation within Powys, so it's not the training for me, if you like, because I used to deliver that sort of training for a number of years. So, you know, that's the reason why I haven't been.
Okay. Lovely. So we're thinking about our survey findings. We had really positive feedback from the survey findings about our training. Is that something, I mean, obviously only a few of you have attended, but is that something you would agree with? Yeah, lovely. Obviously within the sector, there's any number of courses that are available, priorities for organisations, and interestingly enough, within the survey, admin courses came up quite highly that people requested, as well as governance is obviously and funding. You know, that old chestnut never goes away. That'll always be one of our most popular courses. Are there any other courses that anybody can think of that would strengthen our training offer? And it could be absolutely anything to do with running a voluntary organisation, working in the third sector. John?
Yeah, I think sort of digital skills sometimes get a bit left behind. Using Zoom and Microsoft Teams, they've all got their little intricacies, and obviously it's been invaluable of late. And sometimes just things like keeping up with Word documents and email, because I've been out of sort of the administrative side, working side, for quite a number of years, and obviously I'm using IT and Microsoft and other programs, and it's just getting back to grips with that. So I don't know whether you do them now or still.
That's an interesting one.
I think I'd like something like that as well.
Yeah.
If we're going out delivering presentations, just to make sure that we know what we're doing in comparison to you guys, especially when it comes to sharing and sort of leading the.
So like literally, you know, like how you share a presentation and make sure just the technical sort of intricacies of running a session online type thing.
Digital communities Wales do run some training around, you know, using Zoom or Teams or things like that. We don't necessarily do the things on Word and stuff like that because we believe there's other stuff out there. But we do have a range of training, a program that enhances digital skills, which you can find on our website or talk to me, and we can, you know, we're happy to work in partnership with Pavo about putting on courses that you know as part of your program, and stuff like that. So we're happy to do that. When I used to deliver training for the voluntary sector, delivering presentations was one of the ones it was quite popular, because again, it's not just about using the equipment, but it's also about standing up in front of people and all that thing. So that is always useful for people when they have to do presentations.
Yeah, and delivering a presentation online is a very different skill set to actually being in a room with people physically, isn't it?
Yeah.
Okay, so I think, Melissa, that's an action for us, is to link up with Ian to look at getting some of those courses on our training programme. That would be great. Something in the chat. Ruth, the whole area of community development, cohesion and diversity. Gosh, that's a big area, isn't it? Any other comments you want to make about that, Ruth?
Well, I think, I suppose there's two sides to what I was thinking when I did the survey. One is that once people have done the basic Pavo training, it's rather basic. It doesn't go anywhere. So the point I made in the presentation, the health presentation, was that, you know, there's no pathway for staff or volunteers really. You know, there isn't an MVQ in working in the voluntary sector. And then there's very specific skills which we have to use every day really. Rightly, you know, about working with communities. And I mean, if you look at the UK situation, there is no there's no degree level training now, apart from in Northern Ireland in community development. And at a lower level, I mean, working with councils and communities and things is really bread and butter. But there's some very difficult issues, which I think none of the training available really addresses actually. And I think diversity in Powys is a really important topic. I mean, the work we've done, you know, there are lots and lots of people living here from diverse groups, but I think we're training as if we're just training for a kind of monocultural population really, and it's not like that anymore. I mean, a census totally underestimates the number of people living here from all over the place really. So I think that it's that whole area is quite tricky, and I think more skills to deal with it would be great actually. I mean, who would deliver them, I'm not entirely sure, but you know, I think it's a really important subject.
You make a valuable point there, Ruth. I mean, obviously, Pavo as a CBC is part of the third sector support network of Wales. So it may be that some of our counterparts in other CBCs might have some courses on that that we could link in with. So that would be an action for us to see what other CBCs are delivering. But some really useful points there, Ruth, for us to consider moving forward. Thank you for that. So HR and aspects of HR. Yeah, because I know very often voluntary organisations will sign up to an HR organisation, won't they? But
they're very costly though.
Yeah.
We're fortunate we have just recruited a new trustee with a HR background,
right?
But from a strategic point of view, she will be supportive, but it'd be helpful to have just some basics on you know, we've had somebody who started recently and wasn't really performing, and she had quite a bit of time off, and I wasn't quite sure how to manage her period of her trial period, and just how to develop sort of template letters then for those occasions when you have to write to people. So
okay.
We have recently done a bespoke course for an organisation, particularly looking at managing difficult conversations and supervision and appraisal.
Okay.
So perhaps we could look at something there in terms of that's actually tailored to your organisation rather than more generalised.
Okay, thank you.
I think managing volunteers is also quite important, because that's, you know, that's very different to managing staff. So to make sure that's included in training sessions, I think is important.
Yeah. We do cover that as part of our volunteer training, but it is a hugely important issue because it's very much so. And then team building and effectiveness of teamwork. That's an interesting one. Emma, do you want to say something about that?
Going to end up shooting myself in the foot here and end up delivering one. Yeah, I just think in terms of, well, wherever, workplace, voluntary, whatever, it's really important to have that really strong team ethic. And I know a lot of certainly committee groups, etc., that I've been on in the past have not had that. So it perhaps would be helpful for third sector organisations to have an insight into that. Whether they'd attend, you know, it's another thing, but it might be an idea to have that on offer for them.
Okay, interesting one. Thinking of time of day for or when you can attend training. I mean, mornings came out really strongly in the survey. Any comments about when you're available for training, or when we should we consider changing when we deliver our training courses? Gareth.
What is the numbers you need to run special? Because I'm looking at your safeguarding one, and it's really interested me, because just side that we've got a group that want to set up a youth club in Hay, so it'd be really good to do some safeguarding training. But I know quite a few of those work day times and stuff like that. What's a number or optimal number that you would want for like a free session for something like that? So for an early evening.
So in terms of Pavo courses, we run them on when we have 5 people. That's when we will run the session, because we want to make sure that people have a chance to talk to each other. And if it's a smaller number than that, then it tends to just be mainly trainer input rather than those discussions going forward. So 5 is kind of the number we build it on. Again, if in terms of evening sessions, more than happy to kind of work with you and put something together for a group of people. But yeah, happy with evening sessions as well as morning and afternoon sessions to deliver.
Brilliant, thank you very much. I'll feed that back to them. There's a bit of a side that you put that up, and I thought, oh, that's a really good opportunity, because I know there's other stuff I do that links into that. So I'm sure I could get a group of 8 to 10 together, no problem. But I'll encourage them to join that one in December before anyway.
Brilliant. Our safeguarding courses are limited to 12 places.
Limited to 12.
Because,
brilliant. Okay,
yeah.
Cool. That's yeah. As long as I know those bits, that's fine. I'll be back when I meet them. Thank you.
Lovely. Thanks, Gareth. I mean, obviously, I mean, John and Anne, you've both attended face-to-face training courses, which is a very different experience to doing a training course online. And the survey came out really strongly, didn't it, Melissa, that people wanted online training. Is that something you would all be supportive of?
Yeah, I mean, we've got used to doing it over the last 18 months, and it's surprising, you know, travel and just it's so much easier online. It is just a little bit more difficult sometimes to have that 5-minute coffee break and chat to your peers.
I think it's a case of, you know, we need to build in that time, because that is important, you know. Yeah.
I think you can do everything online that you could do in a face-to-face meeting room, and as you say, build in those coffee breaks where people can go into another room and have chats and stuff like that. So I think that's the important thing around, and people mentioned about networking being very important. So it's building that time into the training course where people, you would normally during a coffee break have a chat to the other people on the course, or you know, you might do it lunchtime or whatever. So building that social networking bit into the course, but because you've got breakout rooms and, you know, shared whiteboards and all sorts of things, you can do everything you do in a training room online. And I think it's in a county like Powys, where you're so spread out,
it's an asset,
it's perfect.
Yeah. John, did you want to say something?
Yeah, I'm not too sure about that. I'd find networking much easier in person. Online, it's difficult if you're in a breakout room. Sometimes you put into breakout rooms, you don't have a choice on who you're with, and you just don't. There's just not that interaction. And I'm speaking as somebody who's a service user who's sick to death of Zoom at the moment, because obviously I have health conditions as well. I find just meeting people just brighten, you know, it just breaks up the day. And I think we're in danger of putting everything online at the moment, and it can be quite off-putting, you know. And I think there's also barriers with age consideration, and people who aren't technically, they might be brilliant socially, but online you don't get the impression that they're fully engaging with you. So it'd be great to have a balance, right? And I think there's very much a danger of doing everything online.
I agree that it has to be a balance, and there is always going to be a need for face-to-face. But there are some developments that are going on. There's some software that allow people to be in a room, and as if you would physically in a room, if you move closer to someone, you get to hear what they're talking about. So you can actually kind of, just like you're mingling in a room, so as you move closer, you get to hear what they're talking about. You can join in, you can move off, join another group. That may kind of help, but again, that's a little way off for everyone.
That's way off, because you look at Powys, what you're talking about. Servers can enable that, but the basic technology, if you're on a Chromebook and you're doing a Zoom meeting on a 720p resolution or whatever, and your speakers are crappy little tiny things, it doesn't work. You're talking about reality headsets now that would enable that, but who's got £300 to get one of those? It's that's way off, I think. But I can see where you're coming from.
Yeah. I think there's it's got to be a balance, hasn't it? Phil, I think that's a good solution. A day. I've done day courses online, and they are absolutely exhausting. And
morale, don't you?
Literally half an hour for lunch, 2 10-minute coffee breaks, and it's not conducive to a good learning experience, I don't think.
I feel the people that are running the learn experience sort of don't get the full value of your attention. So when you ask for feedback, people aren't sort of inclined. They think it's just something else to sort of do. Whereas I've been quite fortunate where the training that I've been on with you guys, like with Mel, it's been short, direct, and I've learned quickly. And then when we've had the team building days where we've come in and met in person, you value that time more because you've been stuck at the computer screen. You go back to the old ways of using a pen and a pencil and just sort of having a proper conversation, doodling while someone else is talking, and just, you don't get that kind of behind the screen, I guess, and you kind of take it for granted that people are putting it on for you as well.
No, I think you're right.
The other aspect as well is if you're inviting service users to attend training meetings, there's so much less value with online. If you want to engage service users and people who are volunteers, then providing a training course that there's lunch included, there's coffees and teas. It might sound trivial, but it adds value.
I was going to say, it's about making people feel valued, isn't it? It's really important. Yeah.
And a considerable number of people volunteer for those social aspects, and I agree that no matter how useful it's been, over lockdowns, then there is, being online doesn't substitute that meeting face to face. So I think and that fulfills some volunteers' needs to be social and meet people and things like that.
Yeah, absolutely. Yeah, really important. One of the questions we asked in the survey was about cost, and I think it was the average cost sort of came up about £20 for a course, didn't it, Mel? What do people think about that that's for 2 hours, isn't it, really, Mel? Yeah,
it's based on 2 hour course.
I think
again,
that's
as a service user, I don't want to pay anything because I should be paid to be there. To increase my skills, and I do enough as it is. When I started volunteering with Pavo, I was just doing patients counsel, and now I've got involved. It's a full-time job, and I don't get paid for it. And perhaps that's something I should look at myself. I don't know, but a lot of my reasons for doing it is to improve things for other people. So but it depends on I'm not looking at that payment sort of side of things.
Any other thoughts from anybody?
I think £20 is reasonable. I mean, it depends whether it's something that gives you a qualification or whether it's just an awareness. I think it depends exactly on what the course is about.
Yeah, I'd agree with you there. I think for £20, as somebody said, you'll have the chance to get out of the house, you'll be able to network with other people, and you'll be able to sort of see what people's true values are, because so much is missed, and £20 is, I guess, 2 hours of the sort of average wage, I guess, and I wouldn't sort of have any complaints against that.
I've joined a few of the WCVA webinars lately, which have been free as well, and they've been really useful. You just get just outside Powys as well, then, isn't it?
Yeah, get the bigger picture, isn't it? There is life outside of Powys. One of the biggest things we had feedback is, am I taking up too much time, Melissa?
No, you're fine.
No, that's fine. Once I start talking, I can't stop. One of the things that came out really strongly in the survey was that organisations were interested in having tailored sessions just for their organisations on issues. Is that something that you as people within organisations think would be valuable, rather than generic training to lots of organisations? You have specific training especially for your organisation and any issues that you might want covered in that training.
We had a tailored governance course delivered by Pavo, which was really helpful. I think some of the problems we have here with a tailored course is numbers, because everybody's got quite different roles, and just having enough people to make that worthy is a bit more problematic for us. But
would you be, if there was another organisation with similar issues that we were aware of, would you be happy to join with that group and to make it more cost effective so that course could run?
Yeah, absolutely. Yeah.
And you'd probably you'd get shared learning through that as well.
Yeah.
It would be nice to see that someone else has kind of similar issues.
I think that's always a help, isn't it? And it always helps to know about somebody who's been through that and come out the other end.
It's just that reassurance, isn't it?
Yeah. Any other thoughts on tailored training for organisations, John?
Yeah, I think it's great, because obviously I work in the mental health area, and sometimes that's not relevant to. It can be a bit niche sometimes. You can have interactions with patients that are sort of acutely unwell, and developing the skills in that. Mine is just by experience, but yeah, if you could develop sort of training specifically, and going back to the cost, £30 is nothing really in the scheme of things. I recently did a co-production, an introduction to co-production in Wrexham, which was paid for me, but that was something like £800, I think.
Wow, that's a lot of money, isn't it?
Yeah, you've got a qualification at the end of it, but you're not going to get anything and any sort of relevant qualification for that. But yeah, if it's relevant, then obviously, yeah, that's highly valuable. Yeah.
Your interactions have been hugely beneficial, and I've really enjoyed the session. I haven't done anything like this for ages, so it's been nice to do something a bit different and see some different faces on the screen, which has been lovely. But please do anything you want to ask or raise, please take the opportunity now, or my email's in the chat bar in the chat pane, so do contact me if there is anything you want to raise after the session.
Can I ask one more? Would it work if you had like a blend, like if you made the opportunities available so that people can come in and do in-house training at the same time you can hold the session through sort of a webinar, I guess?
That's an interesting potential development, I think. Yeah.
Both formats then.
Yeah, sort of a hybrid training. You can either be there in person or be on the screen type thing. Yeah.
Sorry, that's the last one.
That's all right. That was a really helpful one, John.
Well, what I found today is fantastic about the Healthcare Academy. That just being here for that.
It's phenomenal.
Yeah, I'm sure I can get involved in some way with it. Even just if they could, even if I just laid a bit of fibre to the ward, that would help. I can use that as leverage, because so many people have denied me proper access to the I knew they had fibre, but they haven't put it into the hospital. If they've done the hub, they can certainly do it there. So, but that as a facility is brilliant, you know.
It is fantastic, and the potential is just huge. We're really excited because we'll be working with them on developing the training and the skills matrix for the School of Volunteers and Carers. So, which is just, it is groundbreaking. It's not happening anywhere else in Wales.
Yeah,
that's really exciting.
In Powys, you know, because I'm on the Wales forum, mental health forum, they're so impressed by Powys and the things we offer compared to even places like Cardiff.
Yeah.
We're streets ahead of them, you know. It's it's great. Yeah. And I've really enjoyed today. It's been really.
No, it's been a lovely session. You've all been brilliant chipping in. And like I say, lovely to see you all, and diolch yn dod, and enjoy the rest of your week, and enjoy the weekend when it gets here as well, and hopefully we'll see some of you tomorrow at the AGM as well, which would be lovely. So take care, and thank you for coming.
Thank you, everybody.
Cheers. Thank you. Thanks very much. Bye bye, everybody.
Bye bye.